Good morning. I am Akhilesh Kumar, working as a assistant professor at Rama University, Department of Faculty of Pharmaceutical Science. Today I am here to introduce a brief about radiopharmaceuticals. Okay. So today we will discuss about radiopharmaceuticals. What is radiopharmaceuticals and what how can handle and how can use the radiopharmaceuticals. Radiopharmaceuticals means, first of all, know about what is radiopharmaceuticals. Okay, so radiopharmaceuticals are made by two words. Okay, radio means radioactive compounds. Okay, radio means radioactive compound. Okay, radioactive compounds which are above 98 in the number of periodic table. Okay, then we know about pharmaceuticals. Pharmaceuticals means medicine. Okay, so the radiopharmaceuticals which contain radioactive substance, okay, so that is known as radiopharmaceuticals. So here is a introduction or definition. You can see radiopharmaceuticals are the radioactive substances or radioactive drug for use to diagnose or therapeutic interventions. Okay, so why we use radiopharmaceuticals? Okay, just like you can see here, TC Medronate 99M, this is the medicines which is used as an example of radiopharmaceuticals. It is used for the bone marrow imaging. Okay, what is bone marrow imaging? When we inject the radiopharmaceuticals in the body, and we, with the help of radioactive substance, we can imagine all over the bone. Okay, so that's why we use TC Medronate 99M. This is the example of radiopharmaceuticals. Okay, so radiopharmaceuticals, what is radio? Radio means the compounds have radioactive. Okay, so radioactive means the compounds have heavy in weight. For the balance of their weight, they reduce three types of wave like alpha, beta and gamma. Okay, so these are the waves which are secreted by the radioactive compounds. Okay, that's why we are use radiopharmaceuticals with the carefully. Okay, so next is, I hope you understand what is radiopharmaceutical. So next we go on handling and storage. Okay, so first we know about radiopharmaceuticals, then we know, as we know, we are a pharmacist, then we should know about the how can handle and storage of radiopharmaceuticals. Okay, so the radiopharmaceuticals are stored just like, these are not stored just like a other drug. Okay, this is the radiopharmaceuticals which is not stored like a other drug. Okay, so radiopharmaceutical must be stored in well closed airtight container. Okay, so next point is the container should be dark and stored in a sealed area, just because the radioactive waves have ability to change your DNA or damage your DNA. That's why we aware about these harmful effects. So we know about when the use of radiopharmaceuticals. So be careful in handling and storage. Okay, the next point is they should be stored for a short period of time, just because you if you stored for a long period of time, then they may be they may be secreted high level of alpha, beta, gamma rays. Okay, so that's why we should try to store radiopharmaceutical for a short period of time. Okay, then the staff does not expose themselves that he is working with the if he is dealing with the radiopharmaceuticals. Okay, so these are the storage and handling of radiopharmaceuticals. Okay, then next is dispensing. Okay, so dispensing is the most important part of the pharmacist in pharmacy. Okay, how to dispense radiopharmaceuticals. Okay, so the radiopharmaceuticals should not, like radiopharmaceutical should be safe, simple and reliable. Okay, you cannot dispense anyone without prescription to radiopharmaceuticals. Okay, like you cannot dispense to any patient without their prescription of radiopharmaceuticals. Okay, so the first point is radiopharmaceuticals does not expose directly to the patient. Okay, like the radiopharmaceutical does not dispense to the patient directly. Okay, the radiopharmaceuticals you can if need to the patient, then the patient comes in your pharmacy, they give you prescription, a valid prescription, then the pharmacist should contact with their medical staff like nursing staff, then they provide to the nursing staff, medical staff, then the medical staff injected the radiopharmaceutical to the patient. Okay, but the patient cannot deal with directly radiopharmaceuticals. Okay, so the pharmacist should always try that the medicines are used for the patient to give their reliable. Okay, so we try that anyhow the medicine does not provide them side effects. Okay, so the next point is the recommended dose only dispensed which is determined by the pharmacist or on the basis of patient history and dispensed only on valid prescription. Patient history means the age, weight and patient history of the patient. Okay, like patient history means how the patient is deal with the drug, what is the age of the patient, okay, what are the body weight of the patient. Okay, so these are dispensed on the basis of patient's body weight. Okay, so the next point is the necessary record should be maintained. It means the pharmacist should always must be record maintenance of the patient who are taking the radiopharmaceuticals. Okay, so these are the points which is always try to fulfill. Okay, so always when you dispense the medicines of radiopharmaceuticals, you need to try dispense safely and reliable. Okay, so these are about the dispensing. So next point is disposal. Okay, how to dispose after sometimes the medicines, the radiopharmaceuticals was expired, then how can we disposed. Okay, just radiopharmaceuticals are not disposed just like a other drug. Okay, because they can produce harmful effect to the patient or anyone. Okay, so the radiopharmaceuticals are not disposed just like a other drug. Okay, so first point is low level of radiopharmaceuticals disposed in a land at 100-meter depth. Okay, the medicines or expired radiopharmaceuticals which have low level of radio waves, so we can do just 10-meter deep, okay, just 10-meter deep disposed at land. Okay, but high level, what about high level radiopharmaceuticals? Okay, so we need to high level radiopharmaceuticals. Actually, high level radiopharmaceuticals can easily damage DNA or body other necessary genetic. Okay, so high level radiopharmaceutical placed in a specific area for a 50 years for reduce their radioactivity. Okay, so reduce their radio waves. After 50 years, then at least 500 to 1000 meter deep, in 500 to 1000 meter deep we put the radiopharmaceuticals. Before putting the radiopharmaceuticals, we need to follow some steps. Okay, so step one is, first of all we know about the radiopharmaceutical is high level, and what are the frequency of radiopharmaceuticals is high or low. Okay, so before disposal of the radiopharmaceuticals, we need to follow some steps. First is, before putting anywhere of the radiopharmaceuticals, you need to pack them, pack in a yellow color plastic bag. Okay, yellow color plastic bag. In the bag must be add a tag of dangerous. Okay, so then after put in the bag, another white color bag, put in the yellow color bag, put in another white color plastic bag. Okay, after the put into the plastic bag, they should be put in long size, okay, barrels. Okay, then we can dispose to the anywhere. Okay, anywhere like some area where the any persons are not easily movable. Okay, so I hope you all understand about the radiopharmaceuticals, overview of the radiopharmaceuticals. Thank you.